Memorial Day and Veterans Day, they tend to remind me of all the shitty experiences I've had with the VA healthcare system and the VA in general. But, you know, it's 'cause these people are out, like, having their barbecues and nobody really thinks about, you know, exactly what was sacrificed for the things that we have. And, I always say I'm one of the lucky ones, because I am. A lot of veterans end up homeless and things like that. Which I guess is part of the reason I turn to such morbid thinking. But even the ones like me who are lucky enough to get into the VA and have some disability and have somewhere to live, it still sucks. So I'm going to regale you with VA horror stories. These are mine mostly, but also at least one that my dad told me from his time actually working at a VA. Now, my worst experiences ever, as far as this goes, are involved in the Fort Harrison VA Medical Center in Wichita, Kansas, and the Parsons VA Clinic. And I'm just throwing it out there because, like, that's where I had to go. I don't live there anymore. I don't have to worry about blah. Anyway, I had to get a senator involved to even have an evaluation. I mean, it was extremely lucky. I wasn't in a very good frame of mind. I really owe a lot to my mom, because she's the one who pestered me into getting help. Otherwise, I don't know if I would have been able to just do it. But she really pushed me to get help. So I wrote the craziest letter I ever wrote, and ever meant, to the Kansas senator at the time, which got me a VA evaluation. I've been diagnosed over the phone numerous times, without ever having been seen at the Parsons Clinic. The first time was, I don't remember the year or anything. All I remember is the resulting emergency room bill is one of the reasons me and Tank are trying to get our shit together so we can actually get a place in New Mexico to help out my uncle. But, I was living with a friend and her husband and her boyfriend and her kid. And, whatever. It's Kansas. People are fucking weird with their relationships. Whatever. But, I couldn't breathe. Like, I was having extreme difficulty breathing. It was uncomfortable, to say the least. And it was difficult. But you can't get an appointment at the hospital without having to go through the clinic. And you don't get gas reimbursement for going to the emergency room. And I couldn't afford to pay, even just for gas, for somebody to drive me 2 hours to get to an emergency room that would actually see me. Because at the time I didn't know that I could just go to a regular emergency room and just say, I'm a veteran, bill them. But I called up the Parsons Clinic, and I think there was like a few minutes where the nurse was talking to the doctor. And then he comes back and he says, oh, well, you just have a chest cold. And I'm kind of like, you can tell that over the fucking phone? But, you never know what to say when this shit happens. So I'm like, can you give me any medicine, anything? And he's like, oh, no, we can't do anything. You'll be fine, whatever. And, he hangs up. I ended up having to go to the emergency room later, because my breathing was not improving and, in fact, doing the opposite. I ended up having severe bronchitis at the time, and that's why I was having such a shitty time breathing. There was another time that I was also diagnosed over the phone without having been seen. And that was when I was complaining about having a ping pong sized lump on my back, like right by my backbone. And I think I'd also mentioned some weird symptoms involving like my period, but they said, oh, all of it's just your period. And I'm like, wait, so a period can give me a fucking ping pong sized fucking lump on my back? I had to struggle to get seen at the actual hospital, and they ended up removing a pretty good sized cyst. But there's just, you know, this blatant disregard, and I'm not the only one who's experienced it. When my dad was doing clerical work for the VA, he recounted to me on one occasion where there was a patient who had I don't know what it's called. It's that infection that you can get at hospitals that's like really dangerous because it's antibiotic resistant. And this guy was in horrible shape. And I think he was just trying to do something like walk to the bathroom, but he couldn't make it because he was so fucked up with being sick. And none of the nurses were helping him. Not a one. So my dad takes pity on this poor person and helps them get to the bathroom and get back to their bed. And, of course, he got told off for it because at these kind of fucking installations, they don't care about... I should say, they care first and foremost about procedure. You have to follow the proper procedure. And my father was reprimanded for not following procedure. He ended up leaving that job and going to work at Walmart because apparently working at the VA just drains the soul out of you. It's actually really sad. My VA care was so shitty in Kansas that when I got up here and even something as simple as being seen by a doctor up here, even if the doctor didn't do anything, was so astonishing to me that I was just instantly impressed. That was the level of care I was used to. I was used to seeing one doctor maybe once every 3 or so months, and she would give me some pills, and I would go home and try to figure out how the fuck to cope with my life. And I come up here and I have an actual fucking therapist that I don't have to drive to Hellengone to see. I mean, there's still things I can't get, like the VA educational benefits. They really design a lot of this stuff so you can't get it. Because they have a VA work rehab program, but I don't live close enough to the hospital to qualify. Basically, anything the VA can avoid paying for, they will. And if it means that somebody dies, well, they don't really care. At least not as far as I've been able to experience. So, yeah. Happy Memorial Day weekend.